Good afternoon, everyone, and welcome to the COVID-19 update for Monday, November the 23rd. Dr. Ezike and I are joined today by Illinois Department of Employment Security Acting Director Kristen Richards and Illinois Attorney General Kwame Raoul to provide an update on our employment assistance programs. We're going to start today by having Dr. Ezike kick us off with today's medical update.
Thank you, Governor. Good afternoon, everyone. In the last 24 hours, more than 91,000 COVID-19 tests have been reported for a total of almost 9.8 million tests here in Illinois. Today, we are reporting 8,322 new cases and 47 additional lives lost to COVID-19. This brings the total number of cases in Illinois to 664,620, including 11,552 lives lost. Overnight, in the hospitals across the state, 6,171 individuals were in the hospital with COVID-19, and of those, 1,206 were in the ICU and 635 were on ventilators. Last week, we communicated with hospitals that we wanted to make sure we had a fully accurate picture of how many patients could actually be cared for in hospitals across the state. And to do this, we worked with hospitals to fine-tune just how we're defining hospital availability and hospital capacity to appropriately capture staffing capabilities. As the number of people hospitalized with COVID-19 rises, and healthcare workers themselves are unable to come to work, either because they themselves are infected or because they're in quarantine from being exposed, we can't look only at the number of empty beds, but also the ability of the hospital to staff those empty beds. But without doctors or nurses or respiratory therapists or other healthcare workers that can actually care for the patients, it really doesn't matter how many beds you have. So we're therefore defining bed availability as the number of inpatient beds available and not currently in use that a hospital attests can be staffed and ready for patient use within 4 hours. And similarly, hospital capacity is the number of inpatient beds available and currently in use that the hospital attests can be staffed and ready for patient use within 4 hours. Both the availability and the capacity, which we've made clear to hospital now needs to include staffing, are to be reviewed at least daily. Throughout this pandemic, the hospitals have been our great partners and allies. IDPH is currently working with the hospitals, the medical centers, doctors, nurses, and others in the healthcare profession to capture best practices and share them across the board as we continue to battle this pandemic. IDPH just recently hosted a webinar with pulmonary and critical care experts from Rush University Medical Center to share information about mechanical ventilation strategies as it relates to COVID-19 patients. IDPH has hosted many webinars during the response to COVID-19 to share lessons learned and best practices with medical practitioners across the state to ensure that we have the best care for all patients. I want to thank our hospital partners for their continued dedication, for those doctors, nurses, respiratory therapists, all of our healthcare workers who are on the front lines providing direct patient care, but also for those who work behind the scenes so that the hospitals can continue to function during this difficult time, including our food service workers, environmental and sanitation engineers. Let's lessen the burden on all of our hospital team, and we can do this by not spreading infection over this Thanksgiving holiday, by wearing our mask, by watching our distance, by washing our hands, and by getting our flu shots. Thank you for your support. Now I will review our comments in Spanish. Buenas tardes. En las últimas 24 horas, más de 91,000 pruebas de COVID-19 fueron hechas para un total de más de 9.8 millones pruebas en Illinois. Hoy informamos 8,322 casos nuevos y 47 vidas adicionales perdidas por COVID-19. Eso eleva el número total de casos en Illinois a más de 660,000 y más de 11,500 muertes. Desde anoche, 6,171 personas estuvieron en el hospital con COVID-19 y de ellos, 1,206 personas estaban en la unidad de cuidados intensivos y 635 pacientes estaban en ventiladores. La semana pasada comunicamos con hospitales para tener una idea precisa de cuántos pacientes podrían ser atendidos en los hospitales en todo el estado. Para hacer esto, trabajamos con los hospitales para ajustar cómo estamos definiendo la disponibilidad y la capacidad de los hospitales para capturar adecuadamente las capacidades del personal. A medida que aumenta el número de personas en el hospital con COVID-19 y los trabajadores de salud que no pueden ir a trabajar porque están enfermos o en cuarentena, no solo necesitamos observar el número de camas, sino también la capacidad de trabajadores. Sin médicos, sin enfermeras o otros trabajadores de salud que pueden atender a los pacientes en las camas, no importa cuántas camas tengamos. Por eso, estamos definiendo la disponibilidad de camas como la cantidad de camas para pacientes hospitalizados disponibles y no en uso actualmente, que un hospital atestigua que pueden contar con personal y estar listas para el uso para pacientes en 4 horas. Ahora, tanto la disponibilidad como la capacidad, informamos a los hospitales que deben incluir el número de trabajadores. Deben revisarse al menos a diario. IDPH sigue trabajando con hospitales, centros médicos, doctores, enfermeras y otros profesionales de salud para capturar las mejores prácticas y compartirlos por todo el estado. IDPH organizó recientemente un seminario web con expertos en cuidados intensivos y pulmonares del Centro Médico de la Universidad Rush para compartir información sobre las estrategias de ventilación mecánica en relación con COVID-19. Quiero agradecer a todos los doctores, enfermeras y trabajadores de salud que están en primera línea dando atención directa al paciente. También a los que trabajan detrás de escena para que los hospitales puedan continuar funcionando durante este momento difícil. Todos tenemos que hacer nuestra parte para asegurar que los hospitales tengan suficiente personal para dar atención a la gente enferma. Sigan practicando los 3 M's, usando su máscara, mantenga su distancia, lávese las manos y vacúnese contra la influenza. Muchísimas gracias para su apoyo. And with that, I will turn it over back to you, sir, back to Governor Pritzker. Thank you.
Great. Thank you very much, Dr. Ezike. And I just want to remind all of the reporters that are on today that we sent out a set of slides which may be helpful to you to follow on with. It's no secret that the nation's current fiscal crisis is much worse than the Great Recession and more severe than anything that we've seen in decades. People are hurting and people need help. And things are getting worse since Republicans in the U.S. Senate decided to postpone a stimulus package that would help restaurants and other small businesses, cities and states, and the unemployed. The financial shockwaves of this virus continue to ripple through the United States and here in Illinois, often causing the most harm to those least able to afford it. In April of this year alone, the Illinois Department of Employment Security processed more claims than it had in the previous 10 Aprils combined. Even compared to the other worst economic years of the last 2 decades, the 2020 recession has seen almost 3.5 times as many regular unemployment claims compared to the first 9 months of either 2008 or 2001 recessions. And it's not even close. Illinois declared a state of emergency for the COVID-19 pandemic on March 9th. Just days later, IDES passed emergency rules to ease certification requirements for applicants. And I signed an executive order to waive the traditional waiting week for recipients, both of which simplified the claims process and allowed the surge of new applicants to start receiving benefits sooner. Nationwide, state agencies that issue unemployment benefits have become the source of overall economic stimulus for millions of Americans. Not their traditional role by any means, but over just 8 months, they're adapting to this new situation in every way possible. IDES has implemented 5 new federal programs. Normally, these types of programs take up to a year each to get going, but because we're in a crisis, they were put together in a manner of just weeks. Remember that IDES has been a rather small agency that had been slowly diminished over the last 2 decades, with headcount dropping dangerously low from 2012 to 2018. But when the economic crisis came with the pandemic, IDES got to work. The department had to overhaul its website infrastructure, stood up an additional call center with hundreds of new agents, added chatbots and other features to its platforms, and launched a new callback system that entirely transformed the communication process for claimants. As a result, IDES has processed a historic number of claims since March, paying out over $17 billion in benefits to over 1.3 million individuals statewide, more than 16 times the amount of benefits paid in the same period last year. Let me repeat that. That's 16 times the amount of benefits paid in the same period last year. And 2020 isn't over yet. In recent weeks, fewer Illinoisans are claiming regular unemployment benefits. And for some, that's good news because it means that they've gone back into the workforce. But there also are others who are unable to get a job and instead are transitioning into extended pandemic assistance programs. Here's where that leaves us. We now have more Illinoisans claiming pandemic emergency unemployment compensation, the temporary 13-week extension of benefits that Congress passed as part of the CARES Act back in spring, and extended benefits, which Illinois and most other states have provided this year, than at any point in this pandemic. The Pandemic Unemployment Assistance Program, yet another one, for the self-employed, plus the federally funded extra 13 weeks of PEUC benefits for eligible regular unemployment claimants, plus the 7 weeks of extended benefits for eligible claimants, all of those programs expire literally the day after Christmas. So unless the Republican Senate gets a stimulus bill moving in December, Republicans will be putting a big lump of coal in the Christmas stockings of a whole lot of American families. I can't overstate the implications of this. Without assistance from Congress, 5 weeks from now, there will be no way to replace these benefits for the hundreds of thousands of Illinoisans impacted by these programs, which have become an essential lifeline for people who lost their jobs due to the pandemic. This is incredibly dire. Illinois is not alone in this. A recent report from public policy think tank called the Century Foundation estimates that 12 million Americans will see their benefits begin to expire next month. That's more than half of people currently receiving benefits nationwide. We have an estimated 4.4 million people in the US who have already maxed out on their unemployment support for this year. So the clock is ticking. without renewed action from Congress, millions of families across the United States will be plunged into far worse economic hardship than they're already facing. And not just in the middle of the holidays, but also in the middle of the worst phase of this pandemic that the nation has yet seen. We will continue to do everything we can at the state level to protect and advocate for our people. But we are extremely limited in our ability to alter unemployment programs, which are operated in partnership with the federal government. Only the federal government can produce the kind of stimulus that we need in order to avoid disaster for many families here. This is another moment that will define our nation. It will be months before we start seeing real economic recovery that comes with distribution of a vaccine to the general public. Spring is an awfully long way off. So call your member of Congress and your senators at 202-224-3121 and let them know you need them to stand up now and help working families across Illinois and across the nation. I'm going to give you that phone number again to call your member of Congress or your senators, 202-224-3121. Thank you. And with that, I'm proud to hand it over to Acting Director of IDES, Kristen Richards, to talk more about what we've been able to do to support Illinoisans throughout this challenging period. Kristen?
Thank you, Governor Pritzker. Thank you, Dr. Ezike and Attorney General Raoul, for the opportunity to join you today. As the governor mentioned, this pandemic is inflicting an unprecedented economic toll on working families across the state. I'm grateful for the opportunity to share some details about IDES's work to support Illinoisans unemployed through no fault of their own. To provide some context, much of the unprecedented claims data that Governor Pritzker shared has been heaped onto an agency already reeling from years of disinvestment. Department headcount has declined by half over the decade, and in the process, we have lost trained personnel in recent years. I am grateful that with the Governor and the General Assembly's support, IDES was approved to add 226 people to our headcount in this fiscal year. But IDES entered the fiscal year already well below our authorized headcount. So meeting this goal remains an uphill battle when confronted with the pandemic. The unprecedented claims surge that the governor described happened on top of a disinvested system. IDES handled more claims during the first 3 weeks of the pandemic than in all of 2019. So far, we've seen over 2 million initial regular UI claims alone during this pandemic. These dramatic numbers do not incorporate the Pandemic Unemployment Assistance Program, or PUA, which supports hundreds of thousands of Illinoisans that are ineligible for regular benefits. To meet this workload, scaling up staff has been an agency priority. In our call center, we've brought on additional permanent and contractual agents, raising our headcount by around 600%. We also redeployed around 100 staff members to assist with claims maintenance and adjudication and brought back dozens of highly skilled retirees. IDES is also investing in innovative technology and customer service improvements to support Illinoisans through the claims process. From revised claimant letters to new infographics on our website to expanded call center access, our team is committed to finding new solutions for claimants. I want to spend a little time discussing IDES's call center and the steps we've taken to make the agency more accessible. At the outset of the pandemic, calls to IDES were answered on a randomized basis. With only 100 agents on the line, the volume was simply unmanageable. During our peak week in May, IDES received over 1.8 million incoming calls. That's 3 calls every second. With less than a 2% chance of connecting, claimants would call hundreds of times a day to win the lottery and speak with an agent. The system was unfair and unsustainable, and claimants needed something better. And so, in response, on July 9th, IDES implemented the callback-only model. Instead of calling dozens of times, you give us one call to yourself based on the issue, and an IDES expert will call you back on a first-in, first-out basis. This brings order to the call center. Everyone is guaranteed to speak with an agent. In a sign of progress, we've completed over 1 million callbacks so far. And when it comes to wait times, our numbers are continuing to improve. For example, one of our queues focuses on certification, which is the biweekly process that establishes a claimant's continued eligibility. Certification is how benefits are paid. Our certification queue is now able to help more claimants, which dramatically lowers our outstanding calls. What the callback model also allows us to do is put more real analytics and strategy around how our communications can be improved. For example, instead of waiting for claimants to miss their certification day, we can now be proactive. Claimants now receive an email reminder when it's time to certify. This simple solution has led to fewer missed certifications and, as a result, fewer calls to the agency. Most claimants will receive a call back within 7 to 10 days. There are complex issues in our adjudication process that may require some more patience. But we're happy to say that in many cases, claimants can hear from us, within 1 to 2 weeks or less. Finally, IDES is experiencing fraud in an order of magnitude we've never seen before. As we see in the press, and as I hear from my peers in other states, this is a nationwide issue. This is not unique to Illinois. The good news is we're working closely with our state and federal partners to protect claimants and pursue bad actors. I would like to now introduce Illinois Attorney General Kwame Raoul to expand on unemployment insurance fraud and share steps you can take to protect your information.
Thank you, Director Richards, and thank you, Governor and Dr. Ezike. I'm pleased to join you all here today to talk about our state's ongoing response to the coronavirus pandemic, which includes addressing the fraud and scams connected to the pandemic. Just as we saw scammers attempt to take advantage of people by way of price gouging on PPE or peddling phony coronavirus treatments, tests, and/or cures, we are now seeing widespread fraud aimed at taking advantage of the economic uncertainty the pandemic has caused. Since July, my office has received nearly 850 written consumer complaints and approximately 4,000 calls to our hotlines about unemployment insurance fraud. Unfortunately, I myself can attest that anyone can be targeted by these scammers because I myself received a phony debit card in the mail. If you've received an IDES debit card or a letter approving you to receive unemployment insurance benefits that you did not apply for, it unfortunately likely means that an identity thief applied for benefits using your name and/or your social security number. Unfortunately, social security numbers of some people have been obtained by some fraudsters as a result of a number of data breaches over the years. My office is committed to looking into this fraud and helping Illinois residents avoid being victims of identity theft. We have been in contact with the Inspector General's office at the U.S. Department of Labor as we collaborate with them and other law enforcement partners to investigate this matter. These investigations can take time, and people need to act to protect their personal financial information now. Always be vigilant and keep a close eye on your financial account statements and credit reports, and that is extra critical right now. We advise taking the following steps to protect yourself if you think that your personal or financial information has been compromised. And these steps including monitoring your credit report. You can check your credit reports from the three major credit reporting agency, Equifax, Experian, and TransUnion for free once per week through April 2021 by visiting annualcreditreport.com. You should consider requesting a fraud alert by contacting one of the free nationwide credit bureaus. This places a flag on your credit reports for 1 year, which means potential credit grantors receive an alert telling them to request additional identification from someone applying for credit using your name. You should also consider placing a freeze on your credit report, which means that potential credit grantors will not be able to see your credit report unless you prove to them that you are who you claim you are and not an identity theft. In order to place a credit freeze, you must contact each of the 3 credit reporting agencies individually. And we have detailed information as to how to go about that on our Attorney General's website at illinoisattorneygeneral.gov. You should all obtain your free credit reports from annualcreditreport.com. And then after reviewing those, report any unauthorized accounts or inaccurate information to the credit reporting agencies. It's important to constantly review all financial accounts to make sure there aren't any irregularities that you don't recognize. And consider placing transaction alerts with your bank or financial institutions. Be vigilant for other unusual occurrences, such as receiving other debit or credit cards in the mail that you haven't applied for. And try to change your passwords on your financial accounts frequently. People can find more information on my office's websites, again, illinoisattorneygeneral.gov. And I also encourage to report any such identity theft or breaches to your accounts to the Identity Theft Hotline at 1-866-999-5630. You can contact us there for help and for more information. This time I'll turn it back to Governor Pritzker.
Attorney General Raoul, and the same to our IDS director. And you guys will hang on. I think reporters may have questions for you. Jordan, you want to launch us?
Yes, we'll start. Governor, we have a bunch of different questions, but we'll start with one common one that's come from a bunch of people: Amy Jacobson, Rachel Hinton, Jim Leach, WMAY. Why are we doing these briefings virtually this week?
Well, as you know, I asked everybody last week, beginning Friday, as part of our Tier 3 resurgence mitigations, that if they work in an office setting, that if it's at all possible for them to work from home, they should do so. So I've asked my entire staff to do so. We have only a few people in the governor's office right now, but everybody's been working all day and will continue to this week from home.
All right, Jim Haggerty at the Rockford Advocate. Governor, at least one Rockford hospital is utilizing beds left over from McCormick Place. What is the status of the rest of those beds, and will there be more available if hospitals need them?
If you're actually asking about the physical beds themselves, quite a number of beds were made available to us, and we've provided them wherever they might be needed. I do want to remind you that for most hospitals, it's not so much a matter of the physical bed that they need in order to expand their capability, but rather staff to be able to staff the number of rooms and beds in the hospital. So we're going to continue to try to be responsive to all the hospitals across the state that ask us for any resources. And I don't know if Dr. Ezike has anything else to add to that. Nope. Okay. We'll move on.
Peter Hancock at Capital News, Illinois. This is for Dr. Ezike. The FDA granted emergency use authorization over the weekend for a pair of antibody treatments for COVID-19. Are there plans to introduce this in Illinois, and how long will it take to ramp up production to make this widely available?
Right. So we know that the bamlanivimab is a monoclonal antibody that did get EUA approval. The government has already provided us over about 8,500 doses. We have teams that are working right now to discuss the equitable distribution of this very important resource. We're going to make sure that in terms of communication that the public is aware of this resource and who are the appropriate candidates. This is for high-risk individuals, older individuals, people with comorbid conditions that would potentially have a worse course. And so this infusion is to be given early in the infection to help prevent any hospitalization. And we also heard about Regeneron. So we're grateful for these scientific pharmaceutical advances. And as soon as we get any of that, and we'll also be reaching out to get as much as we can, we will make sure that those resources are equitably distributed to every part of our state.
Dr. Ezike, this one is also for you from Sarah Schulte at ABC7. Do you think the harm reduction philosophy that has been used for HIV and the drug crisis can be applied to COVID?
I have been trying to use that. I know some people would say that, oh, you're talking out of both sides of your mouth, but the truth is I always give the safest methods to proceed. And then for people who are not going to follow that, at least I try to give, quote, the harm reduction strategy, something that's not quite as safe as option A. But if you aren't going to follow option B, A, then I try to give the best ways that you can make your choice a little bit safer than maybe what you would be doing. So yes, I think we're trying to utilize that harm reduction principle.
This is from Tony Arnold at WBEZ. People throughout Illinois are reporting barriers to getting a COVID-19 test, including long waits, and people of color are especially under-tested. What specifically is are Illinois leaders doing to help fix this issue?
So let me begin by just reminding you that because we're the third largest testing state in the country, it's almost as if, it's difficult for us to significantly ramp up testing, at a faster pace than we already are. Having said that, I want to make tests available wherever and whenever they're needed. There has been a significant uptick of interest in getting tests just before Thanksgiving, so we've seen those long lines. Having said that, we continue to use our antigen testing on top of our PCR testing. We've tried to expand the number of lanes and the free testing drive-through facilities that we've made available. And we continue to look for the expansion of our saliva testing. But I have to say, there is just a physical limit to the number of tests that can be done at this moment. And, we're running up near the limits of that.
Kelly Bauer at Block Club is asking if Illinois tracks potential reinfections that have not been confirmed by the CDC. If so, what are those numbers that we're seeing?
I'd like to turn that over to Dr. Ezike, if I may.
Okay, so the CDC criteria for having a reinfection means that you have documented confirmed infection and we're able to isolate that specimen from the first infection and then have the same on the second. I don't think we have any cases in Illinois of documented infection, but I know across the country there have been clear cases of documented reinfection. Per the definition, it's not considered reinfection unless it's outside of 90 days from that initial infection. And so that's just another important piece of the puzzle to understand when we talk about reinfection versus is it sequelae of that first primary infection.
Shelley Bremer at NBC5 Chicago. Many outbreaks we have seen here can be traced back to weddings. We've also seen many reports on a growing number of cases tied to the Sturgis motorcycle rally in South Dakota over the summer. Has IDPH tracked any cases to that event?
We have many connections of additional cases from weddings, from other large gatherings, which is the reason that we are trying to just limit gatherings. That Sturgis bike rally is said to be connected to many thousands of cases by extension. It may not be that even a single person in Illinois was there, but through many people from many different states were there who could have come back and infected other people. We know the example in Maine where a single wedding resulted in 170 cases and 17 deaths, and none of those individuals that died from COVID were even at the wedding. So there's this extending effect where you can hurt people way downstream that you don't even know.
She had one follow-up that is asking about what preparations are being put in place now to deal with a potential surge from all of the traveling over the holiday. Is it possible we might see another stay-at-home order following a spike after Thanksgiving?
Well, we've put in place the preparations. Indeed, we're concerned, deeply concerned, about the rising number of infections and the follow-on hospitalizations, ICUs, people on ventilators, and of course the deaths. And so, what we've done is make sure that we're doing everything we can to limit the spread with mitigations. We've been working with the hospitals to make sure that they have whatever they may need to prepare for this, uptick. I am concerned that people are not following the mitigations, because I even saw a story about a mayor here in Illinois who flew to a wedding in Florida, didn't wear a mask at the wedding, had more than 50 people at the wedding. And that's the kind of thing that's precisely what we ask people not to do. So I'm concerned about, people just thinking that this doesn't affect them. And of course it does, and we're going to see the effect of that after the Thanksgiving holiday. And I hope that we are prepared. Mostly what we can all do to prepare is follow the mitigations, wear your mask, keep socially distant, follow the tier 3 mitigations that we put in place.
Sir, may I please add that Thanksgiving hasn't happened yet. People can still change their plans and change the outcome. We don't have to have super spreader events at homes throughout our state and throughout the country and then bring it back. Please reconsider your plans and see if we can be part of the solution to decrease infections instead of part of the plan to increase them.
Hannah Mizell at NPR Illinois is asking, tomorrow the Senate Veterans Affairs Committee is holding a hearing on the COVID outbreak at the LaSalle Veterans Home. In the last few weeks since the outbreak began, the Illinois Department of Veterans Affairs has reported 27 residents have died, which is 23% of the home's 120 residents. It's one of the worst outbreaks among congregate care facilities. What are you demanding of IDVA Director Linda Chapalavia as this outbreak continues? Are you satisfied with how the outbreak is being handled?
We don't need to make any special demands of the IDVA director. Believe me, she's as concerned about this, and Dr. Ezike is as concerned about this as I am, and as you are. First of all, as you know, these infections, we have had very strong controls that have been put in place, not just at our veterans homes, but that we've asked of all of our long-term care facilities, including nursing homes. And that's, one of the reasons that we've been able to keep infections relatively low throughout the summer, and even as a percentage of the current infections, is because of those mitigations and those efforts to keep the virus out of facilities. You can't do that 100%. And the fact is that even though we are testing very regularly the staff in facilities, and then testing everybody in a facility if there is even the smallest outbreak. Even though you do that, the fact is that when there is massive, widespread community spread, there's no way to keep it out of every facility. There just isn't. There are people who are asymptomatic, who work at the facility, even though they might get tested. They might have COVID the next day or 2 days later after they've been tested, and they can bring it in with them asymptomatically. And just getting two residents, sick has the potential to spread to a much larger number of people. So a lot of infection control effort has been put in, particularly at LaSalle. We sent an infection control team there. We're monitoring the situation very closely, but as I say, there is no way for us to keep this out of every facility, or to even to lock down. I think you saw there was an effort to restart cruises. I don't know if you saw this. And they tested everybody and they quarantined everybody and they made sure that everybody entering couldn't possibly have the coronavirus. And what do you know? They ended up having to dock and having a number of infections on the cruise. And that's, with a ton of effort being put in by that industry to keep it off the ship because they wanted to restart providing cruises. I'm just giving you one example of, if every effort is made, it's still a danger if there's widespread communication of this disease in a community.
Amy Jacobson is asking, what are your plans for rolling out the vaccine? Besides frontline workers, have you thought about people who live in certain zip codes where there's several generations of family living together?
Well, Amy, I'll turn this over to Dr. Ezike in a moment, but I just want to say that one of the big concerns that I have is making sure that we do this with an equity lens, and that includes not only people of color, but rural communities, places that often are left out and left behind, forgotten. I want them to be significantly considered for the near-term possibility of getting the vaccine. But this vaccine is going to roll out over quite a number of months. We're not really going to see, as I understand, the vaccine coming to the general public until perhaps March or April at the earliest. So the first rounds of it will go to healthcare workers and frontline workers, people who are exposed to it potentially on a daily basis, and our senior citizens and long-term care facilities. Having said that, I'll turn it over to Dr. Ezike for more.
Yeah, so just to expound on that, that phase 1A, that first group will be our healthcare workers, and I shouldn't say healthcare workers, I should say hospital workers. So it will include the sanitation engineers and the people who turn the bed over after that COVID patient or whichever patient has left. When that room needs to be cleaned to prepare for another patient that's coming right in, those people are obviously in contact. The food service workers who deliver meals. And so a lot of those people in those jobs are our Black and Brown communities. And so we are going to make sure that they are included in that first phase 1A. But of course, the governor has always been committed to equity. He's ensuring that equity is a priority across all of state government. It's always top of mind for DPH, for public health. And we have a health equity workforce work group that's continually looking over all of our processes and policies to make sure that equity lens is focused on all the work we do to make sure that no group is left out, especially the groups that have borne the heaviest burden for this horrible disease.
Dan Petrella at the Tribune, can you explain how these unemployment schemes are working? People are receiving letters from IDS. Are those legitimate letters, and how are fraudsters getting the money?
Maybe we can ask our guests, the Attorney General and the Director, maybe starting with the Director, just because I know you see these on literally a daily basis.
If an individual has received a UI finding letter or a KeyBank debit card in the mail and they have not applied for unemployment benefits, that is a sign that they have been a victim of a bad actor. A fraudster has at some point in time accessed their PII, their social security number, their date of birth, potentially through a previous cyber attack, a data breach. We all know that these things have happened. And they have used that information to file for benefits in the victim's name. If you do receive something like this in the mail, please go to the agency's website, follow the steps outlined on our fraud page. We're going to identify for you a 1-800 number. We want you to call us, share your callback information. We are going to give you a call back. We also want to assure you that if you do continue to receive additional correspondence in the mail from the agency and you are a victim of fraud, please ignore that correspondence. You will not be held liable for any payments that are made against that fraudulent claim. Attorney General Raoul, do you have anything that you'd like to add?
I would just say that, this is an ongoing investigation into these schemes, and it's multi-jurisdictional. and we're gathering information. It's important for us to be able to gather information from as many people as possible who may have been a recipient of one of these cards, as I was. And so, as investigations do, it takes time for us to get to the bottom of these things, and we're working continuously with our partners. We've done so in other areas of COVID fraud, which has led to the recent charges against one trying to price gouge on PPE. And so that took time for the investigation to unfold, but we are engaged in that investigation.
And I just want to add one last thing that so that you get a sense, this isn't necessarily anything to do with a cyber breach of state government. In fact, what often happens is you read about in the newspaper, Experian, for example, was breached. You get large credit card companies or large retailers whose systems are breached. And oftentimes, cyber criminals will grab all the information and then they'll lay low on that information so as not to draw a lot of attention. But now they've got potentially your name and your social security number and your date of birth, and they can use that a year later. People don't change their social security numbers typically, or their dates of birth, of course. And so that's what we're seeing, in my opinion, an awful lot of data that kind of pre-existed this pandemic, and this is just an invitation. This PUA and these systems that were created by the federal government, are just ripe for fraud. And I think it's those major cyber criminals that are doing much of the work, in my opinion.
Jake Griffin at the Daily Herald. Can you talk about why the state hasn't developed an exposure alert app like many other states to help with contact tracing, and if this is something the state or IDPH is working on?
Well, I'll begin just by saying that the University of Illinois has developed an app that they use on campus. There are apps that have been tried in other states. One of the challenges with these, and so we've looked at them. I don't want you to think that we're ignorant to the idea that we might use them. One of the challenges with them is there is potential for breaches of people's privacy. So we're concerned about that. I think secondly, the adoption rate in other places of these has been relatively lower. I've seen adoption rates of 17 and 20%, which is, okay, but it doesn't get you what you're really looking for in terms of sort of instant access to people who need to be contact traced. It's not to say that there isn't any use for it, but it's something that I've been personally a little bit wary of, and all of us continue to review the kinds of apps that we might use on a statewide basis, but there hasn't been one that hasn't been of concern. But Dr. Ezike, do you have anything you want to add?
No, I think you've covered it. I think it's something that we're still looking at. It's not out of the realm of possibility. So you could argue that having 20% of people who we can easily contact might be helpful. So we're still exploring, and it's not off the table. So more to come on that.
Alyssa at WICS is asking, if a local government decides not to apply for funding through the local CURE program due to their small population size, what else do you advise to do them for support?
Well, I mean, we've stood up a whole bunch of programs to support people who live in their communities. But if they choose not to go after local CURE dollars, then obviously there are all the other ways in which the state continues to fund cities and counties, and will continue to do that. But there really aren't any new programs other than this major CURES program, which I do want to encourage all local governments to apply for. It is still available. There are many, we just put out a press release about this, many local governments that have just not gone after the money, and we've called them up directly in many cases to say, do you want to apply? Can we help you apply? And so on. That's all being run through DCEO.
Through Matthew Roy at WICS, Board Director Richards, how much money has been wrongfully paid out in fraud claims this year, and how is the state planning on recouping those funds?
Share of dollars that we believe may have gone out, would have gone out under the Pandemic Unemployment Assistance Program, the federal program. But, you know, we are, by and large, able to stop most fraudulent claims before they are paid. And the state will continue to partner with USDOL, Office of the Inspector General, Attorney General Raul's staff to work on recouping any stolen dollars.
Brian Boyles at Health News Illinois will be our last question today. We've started to see a decline in the state's positivity rate and a slight decrease in daily cases over the past week. Is it possible we may see a decrease in hospitalizations and ICU usage over the coming weeks and before a potential Thanksgiving spike?
Well, I'm glad to hear a health publication that is precisely who I would expect to ask a smart question like that. You know, the fact is that many of the other indicators are lagging indicators. So you're right to focus on the cases and hospitalizations. And I don't want to predict. I can't predict, I must say. What I can tell you is that the recent moderation in the number of cases and the positivity rate certainly is good news. I think it is an effect that comes from the previous mitigations that we put in place. We had tier 2 and tier 1 mitigations. The tier 3 mitigations, which went into effect just 3 days ago, probably have not borne the fruit yet that we want to see. So I think that's good news. I think potentially counteracting that, though, is, and there was a question about this earlier, if people are not going to follow the mitigations when they're having their Thanksgiving, you know, they're potentially going to have more infections. I'm hoping that the work that we're doing through tier 3 mitigations and other people following them will, you know, will perhaps offset those numbers. But look, what I really am hopeful for is that people do follow the mitigations over this coming week and the weeks subsequent, and because we, you know, yes, the numbers have come down, but they're still double-digit numbers, these positivity numbers. And we're still at, you know, on average, more than 10,000 cases per day. And so we have to bring those numbers down. We have a lot of work to do. This is going to take, you know, weeks, not days. But, you know, is there a glimmer of hope? That there is, and I'm always looking for that glimmer of hope.
Okay, I lied. There's one last question for Dr. Ezike from Mary Hansen at NPR. Dr. Ezike, you mentioned a change in how hospital capacity will be calculated. When will that be reflected in the data on IDPH's website? And have you seen, or do you expect to see, a big change in capacity levels by including staffing considerations?
Yes, it has been incorporated, and we have started to see a decrease in the number of beds available across the state. So yes, that's in effect now.
All right, that's all the time we have for today, guys. Thanks so much for joining us. We'll see you tomorrow.